Good afternoon, distinguished judges, ladies and gentlemen. I'm Nicole De Silva, an advanced diploma student of physiotherapy following at IIHS. And this was a group study, so I'm presenting on behalf of my group of 5. So our study was regarding the musculoskeletal issues among the Toddy Tappers in Sri Lanka. These are my contents. And starting off with what toddy is, it is an alcoholic drink made by fermenting the sap of coconut flower, and the Toddy Tappers' task is to climb the coconut tree and obtain the sap from the coconut flower. And as you drive down the road from Colombo towards the south, the signs of these Toddy Tappers become apparent because their presence is signaled by the ropes that can be seen tied between the tops of the coconut trees. Toddy tapping process involves a few steps, which it starts off by tapping the toddy flower, beating the toddy flower for 3 days, and after that the flower is cut, allowing the sap to drain out. So in order to collect this sap, the toddy tapper would climb the tree and tie a container in the evening, which is left overnight, and the contents would be collected the following day morning. So when you look at a typical toddy tapper, you would see a few equipments hung around his waist. So these equipments include a large container to collect the contents, and a wooden box which includes the tools that are needed for the process of toddy tapping, and also a coiled off rope. So the day of a typical toddy tapper would begin at around 3:30 or 4 in the morning, and each of them would tap around 50 to 100 trees per day. So if you take the geography of Sri Lanka, there are over 6,000 families along the southern coastal belt alone, and a large number of these families depend on this industry for their livelihood. However, according to the Distilleries Company of Sri Lanka, coconut toddy industry in the country is collapsing alarmingly. So what could possibly be the reason for this? There are probably several. However, health could be one of the main reasons, and as physiotherapy students, we decided to look at the musculoskeletal aspect of it. So our objectives were to identify the musculoskeletal issues associated with traditional coconut toddy tappers along the coastlines of Sri Lanka, as well as to determine the musculoskeletal injury risks associated with traditional means used for toddy tapping. It was a mixed study, and it was done for 12 toddy tappers in Kalatara and Putlam districts, where a purposive judgmentally sampling method was used. And our primary data collection methods included participatory observation, where it was carried out by trained physiotherapy students, and semi-structured interviews which were conducted and recorded. And we used a mobile application in order to measure the degree of scoliosis, if there were any features that we saw, and also visual ethnography, where photographs were used to identify the risk activities from these consented tappers. So moving on to my results, there were altogether 12 male toddy tappers whose ages ranged from 20 to 70 years, and they have been in the industry for about 7 to 40 years with no formal training whatsoever. And they were all full-time toddy tappers. So two themes were identified. First, the activities according to the risk levels, such as when climbing up, the risks that could occur while climbing up the tree, and also mainly when you are moving from one tree to another. So our sample included tappers who had actually experienced a fall at least once during their job. And the other set of activities included the activities that challenged the posture of these toddy tappers. And since this is a very traditional livelihood, there is no professional training as such. It is either self-taught or it is passed down from generation to generation. Therefore, there is no proper technique or knowledge passed down with regards to the effect these climbing techniques have on health or posture. For example, they mention that the distance between each step on the tree is roughly the length from their foot to the knee. So this was the norm because it apparently made it easier to climb. However, when we tried this for ourselves, it was clearly understood that this technique results in a tremendous load being applied on the hip and the knee. And surprisingly, some of the Toddy Tappers stated that they felt more pressure on their upper limb than their lower limb. And we also observed the technique used to walk across from tree to tree on a line of rope. And for all of the Toddy Tappers, what we observed that their hips were always in external rotation due to the way of moving along the rope. So this led to us assessing their foot arch as well, and majority of the Toddy Tappers had high arched foot. And we also used a mobile application to measure the level of scoliosis, and some of them showed positive results, and they also showed shoulder inclination along with restricted shoulder movements. When moving on to the equipments that they carry during their climb, they stated that the container alone can carry 10 gallons of toddy, which is a big amount. So as you can see, this equipment is carried around the waist, and due to its position and its weight, it applies a lot of load on the back and the hip. For my conclusion, I could safely say that the traditional means of the industry could lead to hyperflexion of the hip and the knee, excessive load on the knee joint, and also an imbalance of the load on the hip and the spine due to the weight that is being carried, and a high impact on the foot arches while walking on the ropes. Nevertheless, the attitudes and the lack of awareness regarding these among these Toddy Tappers also made them neglect their conditions, which led to further complications, and ultimately which led to some of them leaving the industry. And a drawback in this research was that most of the Toddy Tappers actually, they were quite reluctant to accept the fact that some of their conditions were due to their livelihood. Moving on to the recommendations, we actually referred a few treatments then and there, and also we think that it's necessary to educate all the Toddy Tappers that the importance of their health for the job and for the industry sustainability, and also these Toddy Tappers should be given prior training and better equipment should be provided, and also a government level strategy should be taken to safeguard this industry. So these are my references. Thank you.